This episode of On the Trail with Frontier Nursing University was filmed on the Pacific Northwest leg of the presidential tour. During this tour, we visited California, Washington, and Oregon. We hosted several events to connect with FNU community members in each state. Our mission was evident within all of the graduates who visited. They all proved to be entrepreneurial and compassionate nurse midwives and nurse practitioners who are working with all people. Meet three of the inspiring graduates we visited on the tour: Lexi Reiger, Marli Parobek, and CE Durfee. Lexi Reiger is a women's health nurse practitioner in San Francisco.
I didn't know anything about what an online program would be. I'm so grateful that I did it, though. I'm so grateful that I did not go to a big city school where I live, and there were many of them, but I loved the niche care, the focus on underserved populations, the focus on the specialties. I didn't want to be an FNP. I wanted to be a WHMP. I knew that. I knew going into my whole career has been in women's health. I want to stick to women's health. And I just loved that program.
So something else that I've been thinking so much about is, our mission has to do with serving rural and underserved populations. And something that you've said a couple of different times is that really, even though, you walk down these streets and it's a highly populated area, but it seems like you've got some underserved populations.
Totally. We are not rural, and this is a private practice with private insurance, but many people need healthcare. So I'm just trying to provide quality healthcare to everyone, regardless of insurance or no insurance. That need is still there.
I think that something else that you have talked a little bit about is just your passion for caring for people kind of across the lifespan and how you like that variety and that kind of thing. Can you talk just a little bit about that and about also your passion for caring for women into perimenopause and menopause?
I talk a lot about perimenopause and menopause. I've had to learn a lot. I read newsletters, I read books, I stay up to date on the menopause research, and I just love it. I feel like I had to do a lot of that research up front to bring on confidence to know what to prescribe and know how to educate people and have them feel confident in me, not having experienced that yet.
What type of advice would you have for somebody who might be considering being a preceptor?
I think just to know that you can make a difference. I still remember my preceptors. I still say words in a room that I heard them say. I think you can make a difference. I think you can really help somebody achieve their goal of being a WHMP. And I want more WHMPs out there. I want my title of WHMP to be known throughout the U.S. Oh, yeah, FNP, there's a WHMP too.
We then traveled to Vashon Island in Washington to visit with Dr. Marli Parobek.
My name is Dr. Marli Parobek, and I'm a nurse practitioner. I'm board certified in family practice and psychiatry. And here on Vashon Island, otherwise known as The Rock, welcome to The Rock, I have my own private psychiatric practice. I knew that there was such a need for mental health, and I wanted to venture into that as an entrepreneur and take that knowledge as a family nurse practitioner, because that's the one thing about nursing. It was explained to me once that we have these volumes of knowledge in our brain, and you can take the nurse out of the clinic, but you can't take the clinic out of the nurse.
Very nice. What about, Marli, what would you say about this community? Because this is a different community than the one you started in. Is that right?
Very, very different. So I love being in a community where I'm serving my neighbors. I see them at the grocery store. I see them at church. And that connection is what makes rural medicine, in my eyes, the most fulfilling. There's no greater accomplishment than to have one of my current clients refer me a family member, that they entrust me with the people that they love. That's what I love about rural medicine, is you are caring for the people that you know.
Thank you. What about something else that you've expressed some passion in, has to do with the rural and underserved populations. Mm-hmm. Can you talk about, do you feel like there's anything unique in the curriculum at Frontier, or anything unique in the experience that made you feel like, we were staying true to those roots in some way?
What Frontier taught me is about community. People come from their community for long distance learning, they take their classes and they go home. And many of us are taking that home to our own rural community, or whether it's urban or even a suburban setting, that is still our own microcosm of our community. Frontier keeps the dedication by keeping it small and personable.
What about your D&P? So I understand you came back to Frontier again to finish the D&P program.
I'm the first person in my family to have a college degree, even as much as an associate. So the fact that I was able to achieve my doctorate is a big deal for me and my family. And the doctorate program specifically at Frontier, I feel so well prepared when I'm in these committee settings and I'm representing the island, or I'm at the American Association of Nurse Practitioners, or as I'm marketing myself, my own business, I feel a sense of pride and accomplishment because Frontier has such a good quality program.
I just want to ask you about, a recent award that I heard about. Can you tell us about the award that you just received and tell us kind of how that happened?
So the American Association of Nurse Practitioners, every year they choose one nurse practitioner from every state for outstanding leadership contributions to the profession. And I think they found my work inspirational, where I just found it as, just what I do. It's really a big deal for me. I'm so excited to receive the reward. And recently, in San Diego, I received the award, and it was a big day for me and my family.
Well, congratulations again. We are so proud of you. And, we've talked a little bit today about making a difference. And that's something that so many of us set out to do as we go back to school and as we, become nurses in the first place. So I just want to acknowledge that we certainly see you making a difference here. And we're so proud of you and so grateful that you've invited us here to see what you're doing.
Awesome. Thank you for coming. This is a big thrill for me, too.
Thank you so much.
Afterwards, we visited with certified nurse midwife CE Durfee in Seattle.
Hi, we're here in Seattle with our graduate C, and we're so excited to learn more about your practice today. Can you tell us just a little bit about your background and your practice here in Seattle?
Sure. I'm CE Durfee. I'm a certified nurse midwife. In Washington State, we call them ARNPs, which is the opposite of some other states, so Advanced Registered Nurse Practitioner. And I'm also a certified lactation counselor. And we are currently in the Maternal Fetal Specialty Center at Swedish Medical Center in Seattle, Washington.
Thank you so much. So can you tell us just a little bit about the population that you serve and just anything about the practice that we should know about? Anything about the background of the clients that you see or just kind of your specialty?
In this population, it's all high-risk people, so people who have multiples, people who have fetal anomalies, people who themselves have comorbidities, so like diabetes, high blood pressure, cardiac issues, history of transplant, history of all the things, and often in combination rather than isolation. If they only have one of those things, we see them in consultation with their regular community provider, whether that's a midwife or an OB or a collaborative practice group. We also have a large population of people who see family medicine providers in Seattle, which is something that I saw way less of on the East Coast compared to here. So that's been really interesting to see the different levels of care.
One part of our mission is just the rural and underserved focus. Do you have a lot of underserved clients in one way or the other around here, even though it's so highly populated and even though there are providers?
Yeah, our catchment area is actually quite large. We have a large population that comes in for care from Alaska. So we have very remote folks that come here for care, and our social workers help to coordinate transportation and things for them. We have a very high migrant population. We have a very high refugee population. I'd say probably only 50% of our people speak English as their first language. We have people that come from very, very far to come here.
So can you tell me how your background as a midwife helps you serve this population a little bit differently than maybe people with other backgrounds?
I think both my background as a midwife and my background as a doula, because I was a doula for 15 years before I was a midwife, really impacts the way that I connect with and communicate with the patients that I serve. I think there's a common misconception that midwives only do birth, or that they only do home birth, or they only do birth center birth. And that's amazing and wonderful, but there's also so much more.
These graduates are providing their patients quality, compassionate health care, regardless of the patient's background and status. And we saw firsthand their passion for caring for those within their own communities. Thank you for watching this episode of On the Trail. We'll see you next time.